Good afternoon. I'm Alan Unell, and this series of videos is Healthcare Advocacy, where we address problems in the healthcare system and then take actions to make a better system for all of us. We have a lot of topics to cover today, including one about nursing staffing, one of my favorite subjects. But before we do, down below in the YouTube description box is a link to the Healthcare Advocacy newsletter that is the text for this video. It has all of the links I mentioned, all the news stories, all the hyperlinks to medical journals when we're doing scientific stuff, and of course all the actions. At the bottom of every newsletter is a collection of resources you might find useful for healthcare, advocating for better healthcare, and in case you need reproductive healthcare, we have a bunch of links. We also have links for claims denials and what to do there. Okay, let's get started. From New York University, labor and delivery units that are adequately staffed by nurses have been shown to have lower cesarean birth rates, according to new research that was published in the journal Nursing Outlook. C-sections, I couldn't believe this, account for 1/3 of births in the United States and are the most common surgery performed in hospitals. Now, while C-sections can be life-saving sometimes, and some are absolutely necessary for the health of the mother and the child, the surgery carries more risks and a longer recovery time than vaginal birth and can complicate future pregnancies. Safely lowered C-section rates would mean improved outcomes. So, the researchers surveyed 2,786 nurses across 193 hospitals over 23 states about staffing in their maternity units. Their responses were collected in 2018 and 2019 and were matched with hospital-level administrative data and rates of C-section and vaginal birth. This is actually a pretty good way to get the data. Better nurse staffing during labor and delivery was linked to lower C-section rates and higher vaginal birth rates, including vaginal birth amongst mothers who had previously had C-sections. C-section rates were 11% lower in hospitals with nurse staffing aligned with the national standard. Hospitals and policymakers often point to increased costs related to both C-sections and nurse staffing. Face it, at the hospital level, they don't want to pay for anything. The researchers note that the cost of adequate nurse staffing during labor and delivery and birth, so that's what I meant, during labor and birth, can be balanced by the savings of avoiding unnecessary C-sections, which includes shorter hospital stays and way fewer complications. I'm just saying, staff up the nurses. Let's talk about a better immune system to fight cancer. Prolonged illnesses like cancer and chronic infection often leave the immune system in a state of exhaustion, where its frontline defenders, those are called T cells, lose their ability to function effectively, and it leaves people wide open to infection. Anyway, researchers at the Doherty Institute and the Peter MacCallum Cancer Center have identified a rare type of immune cell called stem-like T cells, that hold the key to maintaining powerful long-term immune responses. Now, this was published in Science Immunology. The study showed that the endurance of these stem-like T cells is powered by a protein called ID3. It's expressed by a gene also called ID3. These ID3 plus T cells have a unique ability to self-renew and resist exhaustion, giving them the power to sustain immune responses far longer than other T cells that don't express ID3. ID3 plus T cells have the remarkable ability to resist burnout and maintain a powerful immune response over time, making them particularly effective in the face of chronic infections or cancer. These researchers also discovered that the ID3 plus T cell formation could be promoted by specific inflammatory cues, potentially offering new strategies to boost the number of immune cells that excel at fighting cancer in patients. This is all from the University of Melbourne in Australia. There's a link to their press release. Blood test may cut down on some prostate biopsies. Traditional approaches to prostate cancer screening involve blood tests. and MRIs and biopsies. However, in addition to being uncomfortable, some of these procedures can result in overdiagnosis of low-grade cancers. In a new study, researchers at the University of Michigan Health Rogel Cancer Center have clinically validated a previously developed urine test which can potentially bypass these invasive procedures among men who are unlikely to benefit. Prostate cancers are categorized based on their Gleason grade or their grade group. Those with Gleason scores of 3+4 or 7 or grade group 2 or higher are more likely to grow and cause harm in comparison with Gleason number 6 or grade group 1 prostate cancers, which are considered non-aggressive. The urine test is called My Prostate Score 2.0 or MPS2. It looks at 18 different genes linked to high-grade prostate cancer using urine samples from a cohort of 266 men who did not undergo a rectal exam. They found that the test could detect 94% of GG2 or higher cancers and was more sensitive than blood tests. The rectal examination, what they do, I will go off script here and tell you what they previously did with the previous test was they would actually press on the prostate and then they would get material that would be expelled in urine. Okay, now they're finding they don't have to do that. Further, the team used mathematical models to determine that the use of MPS2 would have avoided up to 53% of unnecessary biopsies. Boy, that sounds good. MPS2 is currently available through LynxDx, a University of Michigan spin-off company that has an exclusive university license to commercialize MPS2. Patients or doctors who are interested in learning more can call the Michigan Medical Cancer AnswerLine. Their number is 800-865-1125. And that number is in the newsletter, of course. Okay, well, let's get to it because we're in the midst of a new administration. And guess what? No surprise, Trump continues to screw over healthcare. Data has been removed that threatens public health. President Donald Trump's end of diversity and equity and inclusion language in federal agencies has caused U.S. health data to be removed or not updated. Medical experts warn that the losses, even in areas like flu and COVID tracking, where DEI is not very central, make it harder to manage outbreaks and fix health disparities. When they take that data away, we're absolutely blind, said George Benjamin, executive director of the American Public Health Association. The true impact is that more people will get sick and more people will die. You can find a link to more data on this in Bloomberg News in the newsletter. Trump is also removing EPA scientists. This guy's a real charmer. The Trump administration warned 1,100 EPA employees that they could be fired immediately for their work on climate initiatives, air pollution, or environmental law enforcement. What the hell else are they supposed to do? Anyway, the Trump administration also ordered the U.S. Department of Agriculture to remove climate change references from its website and paused funding for climate-related agriculture programs. Meanwhile, a new study projects that climate change will wipe out, get this, $1.47 trillion in U.S. home values by 2055 as rising insurance costs and extreme weather make some areas less desirable, like Florida, the Florida coast disappearing into the ocean. Anyway, there's a link to a wide variety of news organizations that reported on this, including the New York Times. Let's talk about nominations to the Trump cabinet that risk our health, because this is really important. RFK Jr. and Dr. Oz are still under consideration in the U.S. Senate to lead HHS, Health and Human Services, and the Center for Medicare and Medicaid Services. Last week, there was a confirmation hearing made one thing clear about RFK Jr. He'll do exactly what Donald Trump tells him to do. During the hearing before the Senate Finance Committee, Kennedy made an especially spineless promise. I serve at the pleasure of the president. I'm going to implement his policies. Well, good thing you don't have to think. Anyway, Donald Trump will be calling the shots when it comes to vaccines and also when it comes to mifepristone, funding of medical research, pandemic preparedness, which that guy hates because he closed that office just before COVID started, and plenty of other crucial public health issues. He'll also be calling the shots when it comes to so-called Medicare Advantage programs. This has a long history of harming American seniors. Medicare Advantage, that's, if you're old enough, that's called Part C. President Trump has been an enthusiastic supporter of corporations like United Healthcare in their quest to privatize Medicare. Dr. Oz actively supports this attack on Medicare. P.S., in case you don't know it, I spend a lot of time looking at how they deny claims. United Healthcare also sells ACA marketplace plans, and guess what? They deny 1/3 of medical claims in the ACA marketplace. You don't want them covering every senior's health care because they're just going to say no to what your doctor wants and just drop dead. Anyway, they also want to cut Medicaid, the health insurance program for the poor. It takes care of 80 million people. If they cut Medicaid, there are 9 states that have trigger laws to get rid of the Medicaid expansion. 3 million people immediately lose their health care. And if other states can't make up the difference to the Medicaid expansion in federal budget, then another 18 million will lose their health care. This is an urgent action. Here's a phone number, 202-224-3121, 202-224-3121. Call your senator, say no on RFK Jr., no on Dr. Oz. They don't belong at the Department of Health and Human Services or the Center for Medicare and Medicaid Services. That's a real good way to do it. If you can't get in, then do this. On your cell phone, send a text message, sign space PNT BDF to ResistBot at 50409, and you'll be sending this message. I'll also point out, I'll put in a method that you can use to send the text message on Messenger, Telegram, and Instagram. It's Apple Messenger, Telegram, and Instagram. Anyway, I believe it's Apple. Anyway, I'll put the links in for you. I'm your constituent, and I want you to know that RFK Jr. and Dr. Oz pose an active risk to public health in this country. Kennedy's stance on vaccinations will result in severe illness and death for many. Dr. Oz plans to privatize Medicare, which will result in a severe lack of care for seniors. Remember, United Healthcare denies about 1/3 of the care doctors chose for ACA patients. Moreover, cuts to Medicaid will result in between 3 and 21 million without health care. Do not vote to confirm either of them, as their plans will result in serious harm to millions of Americans. That's what I've got for you. Please take the actions as fast as you can. Have a good evening. Down below, you can like, share, and subscribe. Send me comments here, requests for research here, or at healthcareadvocacy1@gmail.com. Have a good evening.